Are you considering decompression therapy for a pinched nerve in your neck? Discover the truth about this therapy and whether or not it's the right choice for you. In this video, I'll be discussing the effectiveness of decompression therapy for a pinched nerve in the neck, how the therapy works, and the potential risks and benefits involved. By the end of this video, you'll have all the information you need to decide whether decompression therapy is the right treatment for you. Hi, I'm Dr. Daniel Bridge. I'm a chiropractor here in Helena, Montana. This channel teaches you how to keep your spine healthy and how to maintain a pain-free lifestyle. This is our decompression table. We can treat the low back, symptoms with sciatica, but right now I have it set up for the neck, for cervical radiculopathy or that pinched nerve that we've talked about. The patient lays on their back and their head goes right here in the cradle. This is on a track so it can slide back and forth. Once we get them comfortably on their back, we use this to connect their head to the device so that it stays in as it tracks back and forth. After we get them connected, then we hook it up to the machine. So that connects here. And then depending on how much pull we want, we can dial it in exactly. And then what it does is it pulls and it gets some good decompression on that neck and it holds it for a little while. And then it relaxes and it slides back down. And then it comes on back, and it does that over and over again. Depending on how big the patient is, that's how we are able to determine how much pull we can do. But really it's about comfort and making sure that the patient isn't in any pain while we're doing the treatment. Most people report it's very comfortable, it's quite subtle, but what it's doing is it's decompressing the neck, taking the pressure off those nerves, opening up those disc spaces. There are many potential benefits for decompression therapy when you are dealing with that pinched nerve in your neck. Bring that neck pain down, get those symptoms out of the arm, bring the feeling back and the strength back to your arm, all while avoiding a surgery or something more invasive. As far as the risks, they're very minimal, especially if the treatment is done correctly. People can notice some increased soreness, especially after their first treatment, kind of like they can just tell there's been some work done in that area, but usually it's just what the patients would expect. That being said, this treatment is not suitable for everybody. There are some contraindications. If you're dealing with osteoporosis, severe osteoporosis, that's a contraindication. It's something that we don't deal with. If you've had a recent surgery within the past 6 months, you want to wait till that heals up more before we do that. Same thing, if you've had a surgery, you have a fusion or you have hardware in that area, if that's the area we're trying to decompress, we don't do decompression in that area with the hardware. Same thing if you have a recent fracture, if you have instability in your spine, we wouldn't do decompression therapy. And one of the other things we look for is if when we do the treatment, we want the pain to centralize, which means it goes from your fingers to the mid-arm, to the elbow, to the shoulder, to the neck, not the other way around. If your pain starts here in your shoulder and after the treatment it's going down your arm, this might not be the treatment for you. That being said, most of our patients who don't deal with those contraindications do really well with this treatment. It's very comfortable, it's relaxing, and once again, it's very effective. Thanks again for watching. If you have any questions about decompression therapy or you'd like to share your own experience with decompression therapy, please leave it in the comments below. I'll be sure to get to any questions, and I'd appreciate it if you like this video and subscribe to our channel so that you can keep up with our future tips.